the different signs as they are abnormal compared to the normal tongue. Let's get started. Okay, first we look at the tongue color. So how red, pink, or pale is your tongue? If you can look at the slide on the left, this tongue is a little bit too red. Tongues can be all different shades of red, cherry red, dark deep red, and this one is quite a nice bright red. In the middle again, we have our perfectly pink tongue. On the right-hand side, we have a pale tongue. Can you notice how this is a little bit whiter than the pink and definitely lighter than the red? And at the bottom of the screen, we have a tongue that has a tinge of purple. So we have to see if your tongue is pink, is it red, is it pale, and it can have a tinge of purple either by itself. It can be pink with purple, it can be darker red with purple, or it can be pale with a tinge of purple. Can you see what yours is? Okay, let's go on to the next one. The next sign we're looking for is the size of the tongue. Again, in the middle, we have a nice, perfectly sized pink tongue with thin white coating. On the left, if we look at this red tongue again, the red tongue is quite thin. It's quite thin this way, and it's small in size this way. So this is too small of a tongue. You may ask, some people's tongue may be genetically different than other people's. We say that this is their constitution. Some people may run hot, some people may run cold. You're right, but we can see what their constitution is or what their body type is by the size of the tongue, accompanied by all the other aspects. On the right side, we can see that this tongue is quite enlarged. When they open their mouth, it fills up the whole cavity of the mouth. These people may also feel that their tongue is enlarged. They may feel that it's bigger when they start seeing symptoms of illness or disease. So we can check next on our list. Is your tongue too small? Is it perfectly in the middle? Or is it enlarged? Next, we can look at the tongue coating thickness. On the left-hand side of the screen, this tongue has absolutely no coating. As you can see, it's a little bit shiny. Shiny because there's no coating, slick like the mirror. In the middle, though the coating is not absolutely visible, this we call thin white coating as compared to the one on the left, because the left one we call guangtai, no coating, and that shiny appearance of no coating, completely smooth. On the other hand, on the picture on the right, you see an extremely thick coating. Now, anything between the middle slide of normal, anything thicker than that, all the way to the thickness of the slide on the right, will all be categorized as too thick. Not necessarily you have a coating as thick as this person's tongue on the right, but anything thicker than the middle one is too thick, and we need to say that you have classification of thick tongue coating. The one on the left is quite severe. People taking pain medications will actually usually have this tongue, but other than that, the disease is usually quite severe by the time the tongue looks like this. Next, we can look at the color of the coating. We want white, that's quite normal. And if it gets thicker, you can see an obvious color to the coating. So on the left, you can see that the coating is white. It's very pale in color, as opposed to the tongue on the far right, which has yellow. Now you have to be careful when you look at the coating of the tongue, because the coating can be dyed. If you're sucking on a bright red throat lozenge, your tongue coating will be bright red. If you just drank some grape juice, your coating will probably be purple. If you just had chocolate or even black beans, you may have a dark brown or black tongue coating. If you have not had any chocolate, black beans, or other dark colored food, and you still see a tinge of dark brown or gray, this is actually another type of coating. It's not as rare. It's usually in chronic conditions. I did include it here today. But in general, we will look for today, do you have more of a yellow coating or more of a white coating? Or are you perfectly thin in the middle and white? Okay, did you have time to check? Okay, let's go on to the next slide. This is the amount of moisture we have in the tongue. Hopefully you all have a perfectly healthy tongue like the one in the middle, but if you don't, you may have a little bit too moist or too dry of a tongue. This can also give us clues as to what's going on inside the body. On the left-hand side, if you can see, this tongue is a little bit shiny from the amount of water left on the tongue. Some people have so much water on the tongue that it's dripping when they stick their tongue out. And on the other side, on the right-hand side, this picture of the tongue, the coating is very dry. Not only is the coating dry, but the tongue has cracks in it. And the cracks can get more severe than the picture seen here. So we just try to put on the scale from extremely wet to extremely dry. Which of these polar opposites are you closer to? Perfectly in the middle, a little too wet, or a little too dry? Next, we can see if you have any of the special signs on your tongue. Not everybody does, and you might not necessarily have all three if you do, but if you have any of them, then you'll make a note and we'll come back and see what that means. The first picture on the left is a picture of a scalloped tongue. Do you see the teeth indentations around the edge of the tongue? This is one special sign that you may notice. Some people with light indentation is actually normal, but this indentation or this scalloped tongue is quite pronounced, and this is telling us, especially coupled with the other things we see on that tongue, it's telling us that there's something wrong with the body. In the middle, you can see this tongue has lots of red dots. Sometimes you can even feel the dots. They're raised bumps on the tongue. Usually they're concentrated in the front tip of the tongue, but not necessarily. They sometimes can be distributed all through the body of the tongue. And on the right-hand side slide, you can see on the tip and around the edges purple spots or purple patches. The body of the tongue has discolorations on the sides and on the tip. This is the third special sign we can look for. When you see these special signs, they usually jump right out at you, and it's not hard to miss, especially red dots and purple patches and scalloped edges. Finally, we'll look underneath the tongue. What are we looking for underneath the tongue? We're usually looking for two characteristics. First of all, we look for the two veins on either side of the midline. We would like the veins to be the length of 2/3 the tongue, from the base of the tongue where it connects to the bottom of the mouth to the tip of the tongue. We would also like them to be not too thick and not too thin. If we look at the picture on the left, this is a normal tongue veins underneath the tongue. They haven't completely disappeared. They're not too faint, but they're not too large or too long either. The other slide, on the other hand, has quite bulging veins, and they are a little bit long. On the sides of the tongue, you can see a lot of other veins that have also popped out. So this is indicating something's wrong with the body. The second characteristic we look at underneath the tongue is the color of the tongue. Sometimes on top of the tongue, you may notice that the coating is so thick and so coating the entire tongue that it's hard to see the body of the tongue. You may be able to see only around the edges, but if you look under the tongue at the color, you can notice that the tongue on the left is more pink, whereas the tongue on the right is more red. So hopefully you can see in just a few seconds a snapshot at the bottom of your tongue. If you've been looking at your tongue the whole time, the veins are probably popping out, and this doesn't count. You have to take a quick couple second snapshot or you have to let your tongue rest for a few minutes before you try again. So let's take a quick look at those slides again, and we'll see a general trend in heat or cold in the body. Chinese medicine diagnoses in terms of yin and yang. That simply means, is there too much or too little heat in the body, too much or too little cold? Is there excess problems in the body, like stagnation or poor circulation, dampness, something of a water metabolism problem, or is there deficiency, not enough of something in the body? So the normal tongue, they pass. They have everything nice. If we look at the next slide, we get to the color. So were you running red or pale, nice and pink? If you are a little on the red side, red is indicating running hot, a little bit of heat, or too much yang or too little yin in the body. On the other hand, we have the pale tongue, which is more indicative of cold. And the purpleness is telling us that there's poor circulation or stagnation in the body that can result from a variety of reasons. So red, too hot; white, too cold. If we look at the size of the tongue, we can see the small tongue and the large tongue. These are both indicating deficiencies or weaknesses in the body of different kinds. So too small and too large, both indicating deficiency, though the enlarged tongue may also tell us about dampness or a sticky condition in the body, a poor water metabolism. If we look at the next slide, we can look at the thickness of the coating. This is telling us about the strength or weakness of the digestive system. On the left-hand side, the tongue with absolutely no coating that's quite glossy is showing us extreme digestive weakness. Like I mentioned, the people that are taking the pain pills, that's very hard on the stomach lining and other parts of the digestive system. On the other hand, the right-hand side picture is showing us a lot of accumulation of a dampness. This idea of food and fluids that we put in the body not digesting properly, and it creates a sticky condition where the body isn't cleaned out properly, and we need to flush out or transform the dampness. So digestive deficiency versus excess dampness in the body. Next, if we look at the tongue coating color, we can see again the idea of heat and cold in the body. So the more white the coating and the thicker, usually the more cold you have in the body. The more yellow the coating, usually the more heat you have in the body. And if you saw that tinge of brown, gray, and you know that your tongue has not been dyed from eating any dark-colored foods, then you may have more of a chronic condition. Chronic conditions tend to have a slight coating of that brown-gray on the top. The moisture level can also indicate the level of heat or cold in the body. The more heat, you can easily imagine it burning off the fluids in the body. So if we look at the right-hand slide of that dry coating with cracking in the tongue, it usually indicates some kind of heat in the body. Whereas if we have a very moist, watery coating on the tongue or lots of saliva, this is usually an issue of cold and or too much dampness in the body. For the special signs, if you noticed any of those on your tongue, the first one, the scalloped edges or the indentation, is telling us that there is digestive or qi deficiency in the body. The middle one with the red dots is telling us heat, too much heat in the body. If it's on the center tip, it's usually concentrated in heart and lung area, and we can tell these people usually have some insomnia. The coating on the right-hand side is actually not what we're looking for the special sign, but if you can see those purple spots on the sides and the tip, this is telling us there is stagnation located in the heart or lungs and on the sides in the liver or gallbladder. If we look underneath the tongue, we can also tell what's going on in the body, the left being the normal, and the right side showing a little bit too much heat from the color of red again. And then we can also tell that these bulging veins have too much stagnation in the body. So poor circulation, accumulation of excess that needs to be flushed out of the body. Now, if we put all of those signs together and try to come up with a correct diagnosis, we take this one for our first example. Deficiency heat tongue. So we see that the heat signs are several. First of all, we look at the color. It's quite red, red indicating heat. We look at the size of the tongue. The tongue is too small, so it's a deficiency. This can tell us, oh, can we have that slide back? This can tell us that the deficiency heat means that there is not enough fluids and blood in the body. Deficient of good fluid and blood, sort of like a rough translation of dehydration, creating heat. We can also see many little red dots spread out all over the tongue. This is enforcing the idea that there's too much heat in the body. If we look at the coating, it's extremely thin. It's not shiny thin like the Guangtai, the absolutely no tongue coating, but it is very thin. If it were thick, we may think that it's more associated with excess damp heat. But this one is extremely thin, so that's another sign that's showing us this is deficiency heat. Underneath, their veins might be quite thin or non-existent, again signifying the deficiency in the body. This person may suffer from night sweats, they may feel irritable, they may have insomnia, they may feel flush without having a fever, and they may have constipation or firm stools. These are all signs of yin deficiency with heat. So this is one way that we can put all of the signs together and come up with a correct diagnosis. If we look at one more example, we can see this deficiency, cold, dampness together for our spleen Qi deficiency diagnosis. In this, we first look at the color of the tongue. It's actually pretty pink, not too pale. If we look at the size of the tongue, it's not too large and not too small, possibly starting to get a little bit enlarged. If we look at the coating, it's white color, but it's much too thick. The thickness is telling us dampness in the body, and the white is telling us cold in the body. So cold dampness is usually created by a weak digestive system. If the digestive system is weak, it cannot properly digest the food and liquid that we intake, and therefore we create over time a sticky condition in the body. This is further reinforced by the scalloped edge that you see around the tongue. This scalloped edge is indicating some kind of qi deficiency, digestive deficiency, and possibly blood deficiency, but this tongue is not pale enough for blood deficiency. We also may notice that if the tongue were a little bit more enlarged and on the pale side, we may diagnose them with kidney yang deficiency, because as the digestive system is weakened, it draws on the kidney warmth to continue digesting the food. And after a certain period of time, the kidneys will also start to become weak. When this happens, this tongue will continue to enlarge and become pale, and then we'll have kidney yang deficiency. The current tongue that you see will probably have different symptoms like chronic loose stools. They may have fatigue. They may have a lowered immune system, always catching colds. So these are some of the signs of the spleen Qi deficiency. We hope that you can put together some of the signs that you've seen today and come up with a diagnosis for fun for yourself Of course, this is not to replace your traditional Chinese medicine practitioner's diagnosis, but it's always nice to know when you go into your practitioner, what exactly are they looking for? What are they looking at? Why do they want to see my tongue? People always think it's a little strange when I say, let me take your pulse, I can tell about your organs. Let me look at your tongue, I can tell what's going on in the body. If you just understand a little bit about what we're looking for and why we're looking at it, then you will be able to communicate more effectively with your practitioner, and you will be able to monitor your progress, and in the future, you will be able to hopefully help yourself understand how different foods affect you. How does lack of sleep affect you? Staying up all night, you can notice in the morning that your tongue may be a little more red. If you eat too much oily foods or too much cheesy kind of foods, you may notice that your tongue coating is quite thick. This is all fun to monitor and observe and see how your body changes. The more sensitive you can become to your body, the healthier you'll become. I hope you can stay tuned for next time. Thank you so much today for watching, and mahalo.
Good evening, everyone. Welcome to our tongue check hour.
Good evening, Doc. Good evening, everyone.
O sige, gawin natin very interesting yung ating topic para medyo, maybe towards the last 20 minutes of our lecture, I'm going to post yung, we will be talking about the tongue that Ma'am Roxanne submitted. Pero before that, gawin na natin serious yung ating continuing series of lectures. And so far, I haven't seen any material on YouTube that really is parang that will address all of our concerns of tongue, no? Kasi I believe that this is the best way to economize, especially ngayong panahon, di ba? And this is one way of gauging if the practitioner really knows what he's doing. Okay, so I'm also very happy we have with us Sir Timothy from Zamboanga. Sir Timothy, how are you?
Hi, I'm doing fine.
Oh,
Just tired.
Welcome, Hector.
Hello.
Oh, yan si Sir Timothy talagang nag-aral yan on his own, ha? So that's why I'm so always excited to share with him some of my best materials. And parang out of nowhere, they would just pop up. So how's everything, Sir Timothy, in your practice? Challenging ba? Or
Challenging. Yeah. Recently, it's become more intense na eh. We're dealing with like stroke patient. Yeah. Also COPD. Even edema cases that has something to do also with COPD.
grabe.
Very challenging. Actually, the case are a lot of complication na eh.
Yeah. But one good thing about what you're doing is that you could really easily correlate the symptoms from what you see on the tongue, right? And this is
Yes,
something that
definitely.
not everybody is so good at. Yung ano ba dyan, yung nandyan pa ba yung hindi tumitingin sa dila?
Come again, Doc.
Di ba you had a practitioner there who was so boastful about his education, hindi naman NB, and then we
Yeah. She doesn't look at the tongue unless we are there. She would mention, "Oh, look at the tongue," but she doesn't really know what she's saying.
Okay. So
Yeah.
it's like this will be our way of knowing who amongst the practitioners are really legit, no? Kasi parang I feel na it's so unfair to parang you're not doing parang be justified eh, no? And then you are supposed to be certified, and then people look up at you parang you're so full of knowledge. Pero it's just like going to a doctor. The doctor will just prescribe you meds without really examining you, di ba?
Yeah. Right. Right.
Oo, pero di ba like Sir Timothy, like I think it took you only, it's basically common sense, di ba? Like you cannot really appreciate the tongue or pulse if you do not have a no nonsense grasp of the basics, di ba?
Yeah. Definitely, doc. Yeah. Yeah.
And I think this is the only way we can elevate our practice, no? To a higher level para ano naman, we will get the respect that we deserve. The problem is not too many people are serious about it. As long as they could needle, okay na. Yung iba paramihan ng needles, which I really find so disgusting.
Mm, yeah.
Hindi
And
talaga-
one yeah, and one thing I noticed pala, doc, like some doesn't know what kind of needle they should use.
Mhm.
So like majority when I see people needling, they always use the very small needle, the very short needle that is for the
Which-
ears only.
Mhm.
So actually some patients doesn't really find receive or feel anything using that very short needle.
Precisely.
Yeah, that's why I
We,
was telling some of my companions na we need to use long needles, at least 1 inch or 1.5 inch long, for the patient to really feel the sensation.
yeah,
But
and
then a frequent question pala, doc, like why do I needle daw? They feel sensation, but others don't. So
because you know
it's
what you're
hard for me to
doing.
answer because I have technique. I learned a few techniques in needling and using the proper needle for a specific
Precisely.
body part. Yeah.
If you do not get you need to do the right manipulation in order to determine if you really hit the right point, diba? Like you need to know kung saan siya where the chi goes, diba?
Yes. Yes.
That's what uh, separates a pro from a non-pro. Kaya nga so I'm really happy because kahit papano, during the pandemic, we were really able to really dig deeper into this. And this is something that's not so easy to ano, di ba? To kasi for people like as long as they know how to needle, can you imagine treating a chronic problem using short needles, very thin needles? That doesn't make sense, di ba?
Yeah.
And
Right. Right.
small, short needles,
Mm.
small needles for those who are very acute lung. And there's a technique of doing that. And they don't even know when to reduce, when to tonify, and when to not really manipulate at all.
Yes.
Diba?
Definitely. Yeah.
So I was so, kasi si Ma'am Teresita pala cannot join us tonight because meron silang prayer until 9 p.m., 7 to 9. However, she told me that she was so blessed because um, she believed me kasi nga I referred you to her. No?
Yeah.
I hope the others did not feel bad. Kasi, I don't know kasi parang I feel so disappointed kasi parang I think you know who they are in our place. Parang they don't really take it seriously. Parang hello. Ewan ko lang.
Yeah.
Siguro it's about time. We need to really level up, no? And this is the only way we can make the medical practitioners really take a look and look at us as strategic partners, diba?
Right. Right.
Oo, rather than, making them think that we are parang run of the mill yung ating pinag-aralan. So it takes time eh. Kaya 'di ba, so you could really see how important diagnosis is when it comes to treating patients, right? And
Right.
and you need to be able to identify the exact pattern that the patient is suffering from, or you para you would know your treatment principle. And people like you are a rarity. Buti naman, kasi I'm blessed. Like, out of the many who really, ewan ko lang kasi I do not want to think of it as parang katamaran, di ba? Okay, thank you very much, Sir Timothy. Ma'am
Thank you.
Betty, kumusta ba Ma'am Betty? Like, how did you see yourself? Kasi parang na-notice ko, parang halos walang absent si Ma'am Betty.
Sakal kasi ako nagtatrabaho.
At saka Ma'am Betty, di ba, like, I think nag-attend na kayo noong pa sa ating Zoom. Parang,
Opo.
ano ba yung pagkakaiba ngayon? Medyo mas ano ba, parang nakatulong ba?
Parang mas maganda po ngayon.
Kasi nga lumalim na yung ating hindi
Opo.
naman nagpapabad, no? So, ang akin lang kasi, parang people will pay you this much and then they don't. And then if people will keep coming back to you, parang parang unfair, no? So sana mag-level up na. So we're currently working. Merong inaiisip si Doktora Palangka na parang mas matindi. Para makita na kung sino talaga yung matitini. It takes a lot of effort, di ba?
Opo.
Oh, well, yeah. So at least sa dila lang, madam, di ba? Importante talaga. So ni isa walang naniwala masyado when I focus on the tongue, di ba?
Opo. Kasi yung sa kuya ko, tinignan ko yung tongue niya. Tapos sabi ko, pwede ba matingnan ko yung tongue mo? Tapos nakita ko nga yung sa may kidney, parang may uka. Sabi ko, ka magagalit medyo personal lang yun. Kako, active ka ba sa sex? Natawa siya. Sabi niya, ano ba yan, bastos? Sabi niya, bakit pati yung sex? Alam. Sabi ko, kaya pag kami ako puncturist, huwag ka labas ng dila. Bakit? Sabi niya, kako parang x-ray yun, nakikita eh. Sabi ko, ay ganun ba? Oo, nagulat siya. Sabi ko, yun ang inaaral namin ngayon.
Pati nga broken record, alam nyo na, di ba? Pati yung mga sira-ulo. Actually, hindi chamba po yun no? Parang it's galing po yun sa matindi yung experience, no?
Dahil po sa turo ninyo. Siguro dahil matyaga nyo po kami tinuruan, talagang nag-seek in sa utak namin.
Hindi ko naman ito ginawa na parang kasi gusto ko rin matuto Gusto ko kasi 'di ba, parang magagawin natin, 'di ba?
Pero nagulat din kasi ako, bakit naman din yun sa batang yun. Yung pangalawang tanong, yung kagad naman din na natanong ko.
Oo.
Sabi niya, ano ba yan, manghula ba nanay mo? Sabi niya ganun. Natawa rin ako.
Hindi naman tayo nagda-diagnose ng sakit Alam lang natin kung ano yung diferensya, di ba? So siguro it will take a little time. So thanks to the pandemic. Sorry.
Thank you, Do.
Thank you po. Welcome to Ma'am Gretel from the US. Ma'am Gretel, how are you?
Hi, Doc. Good evening sa lahat.
Good morning.
Sorry,
Good
I
morning,
missed you
Jan.
guys.
Anong oras ka ngayon? 8 o'clock?
7:41.
Oh, so it's like...
almost 8 in the morning.
Okay. So hindi pala talaga 12 hours. Parang, ilan ba? 11 hours?
12. Kasi ngayon dyan, na kayo? Magna-9?
Kumusta na Ma'am Gretel yung mo sa Quantumin?
Ay, okay naman. Kaya, so, lang talaga yung, ano bang tawag nito? I was trying to catch up sa inyo dahil na-busy talaga ako. Pero so far, so good. Quantumin is spreading here. May nagbebenta na yata dito din ng mga iba ding, kasi may nakita ako na yung customer ko bumibili sa kanila. Pero sabi ko, it's okay. Wherever you buy, Pero so far, Quantumin coffee is really naging ano na talaga dito yung kape ng Quantumin, pati yung yung Quantumin ng mga
Ilang
products.
boxes na tayo ngayon? 600 for the month?
Yes,
Wow,
almost.
galing.
This week, darating
Congratulations.
Yan yung tatak niya doon. I-reach
Yeah.
coffee ng Quantumin Plus.
Saka ang dami mong alahas, Ma'am Gretel. May mga
Oh,
diamonds ka na talaga, grabe.
so far naman, sa awa ng Diyos. Pero ano talaga, Doc, yung Quantumin talaga, kahit wala akong follow-up sa mga customer, the product speaks its own talaga. Yeah. Talaga. May dalawa akong nag-register na hindi ko inakala. But I did not push registration here kasi pero dahil hindi ko masyadong na mag-work sila, ganon. Kasi wala akong time talaga, parang ganon. Ang nangyari sa akin, parang direct selling talaga. Pero yung mga iba na mga customer ko, they are the one to call me na, ma'am, paano ba mag-member? Dahil gagamitin na namin to as a maintenance as a couple, ganun, dahil marami kaming sakit, ganun. Tapos na-try na namin yung product, gusto namin maka-discount, then I have to discuss. So kaya may nag-register. May isa din ako, Doc, ilang bottles lang nagamit, sabi ko nga, mag-video seal siya. Yung mayoma daw niya, hindi ko talaga alam. Tumawag lang sila at nag-reorder ng product at nag-register.
Alam mo ba, ma'am, no, yung myoma, fibroids yan eh. Dahil po yan sa phlegm. So, if you understand paano nagkaroon ng phlegm, you just have to do something about it. Pag hindi pa naman malaki, hindi naman kailangan tanggalin yan eh. At saka pag medyo maedad ka na, nagkaroon ka na myoma, hintayin mo na lang na mag-shrink. Kasi habang tumatanda, ano siya lumiliit. Ano na pag-menopause na. Okay?
Actually, sabi nga ng mga customer ko, Doc, ma'am, mag-discuss daw ako ng separate na Quantumin lang ba, parang each product. Ay, sabi ko talaga, I really want to, pero yung time ko lang, dahil syempre wala akong ibang kasama dito. Kung tulad lang sa Pilipinas, Doc, na makahire ako ng maraming tao,
Nasaan ka na ngayon, Ma'am Gretel? Nasa Texas?
Texas.
Saan sa Texas?
Sa New Braunfels po, San Antonio. I'm 30 minutes away from San Antonio. Pero baka makalipat kami ng Austin next year, but we'll see.
Ay, bongga. Malapit ba sa Dallas yan?
3 to 4 hours away.
Ay, hindi siya malapit. How's the pandemic? How's the COVID situation there?
Ay, ano din talaga, nag-i-increase din, pero dahil ang mga tao nagpa-vaccine, parang they feel na more secure. Pero kahit ganon, we still wear mask kasi tumataas pa rin. Kahit sa school.
No,
Ako,
actually, I think the best protection there is for us to stay healthy, to stay strong.
Totoo yan.
Diba?
Kaya sinasabi ko palagi sa live na pag acidic yung katawan natin, gustong-gusto ni COVID, kaya nag-order. Ano ba yung sinasabi mong drops at kape? Yun lang ang sinasabi.
Sige. Punta naman tayo sa contribution ni Ma'am Roxanne of Iligan. Okay, we have here a 30-year-old male complaining of probably there are flank pains. Ito din tinatawag kanina na renal colic because of the kidney stones, no? And okay, so anong klase yung pain po ng kanyang kidney stones? Ma'am Roxanne. Colicky. Kasi pag chief complaint, you don't write kidney stones. Kidney stones is diagnosis yan sa ultrasound or KUB. Kasi you need to, what's this? Siyempre, bago niya nalaman na kidney stones, meron na siyang naramdaman. Okay, as you can, Mm. 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 Okay. Anyway, sige, using tongue diagnosis, we could really say na meron po siyang ano talaga, may dampness na, grabe ang dampness. So this is a reflection of accumulation of dampness, di ba, Ma'am Betty? Kaya meron siyang watery stools.
Opo.
So usually pag may spleen issue, like in this case, spleen, this is definitely
Opo.
spleen yang deficient. Na ang pulang, ang puti-puti, di ba?
Mm.
Oo. So, edema on the back of the leg. Okay. There will be edema talaga because of the obstruction. No? And which leg po ito? This is important kasi sinabi dito numbness on the left part of the body. Then we have tightness of the chest, late sleeper. Okay. So, chief complaint should have been the pain. Okay? And then pwede nating sabihin na due to kidney stones kasi when you look at it's pag may spleen yang deficiency kasi definitely may kidney deficiency talaga yan. So in this case, kaya nagkaroon ng kidney stones yan dahil may retention, may dampness. Hindi maganda yung flow. Kaya kung nakikita nyo yan. Okay? So who can comment here? In fact, this is purple already, bluish purple. So there's definitely the stagnation. And the stag is really the one causing the pain. Okay? So I think this is what prompted him to seek consult, the pain. Okay? So may tightness of the chest, definitely. Kasi kung titingnan niyo po dito, meron na po siyang, di ba? Nakikita niyo ma'am, may ano siyang purple dito eh. Oh, this is the chest area. Very good. And late sleeper, frequent urination. Okay, frequent urination because of the yang deficiency. Ibig sabihin, hindi na makapagpigil ng pag-ihi. Kasi when you have a very good bladder function, okay, that means meron kang magandang bladder yang, bladder chi, which is not true in this case. So, hindi niya napipigilan yung pag-ihi. Okay? So, we need to see a change in the color of the, So, kung wala masyado siyang complaints, siguro incidental lang yung findings ng kidney stones. Hindi naman lahat ng kidney stones, nakakatakot, no? Okay. Any comment? Somebody would like to comment, Ma'am Noemi? Or did you see this one here?
There's a crack.
What
Parang
else?
malalim.
At saka yung tightness of the chest, definitely may heart issue siya. Kung nakikita niyo, flat yung dito niya.
Oo.
Diba? And then, I think this is actually purple no?
Opo.
This is purplish na. So, kasi stagnation eh. May tightness of the chest. And I'm afraid this could be blood, heart blood stagnation. Okay? Ang nagpalala niyan, yung phlegm. Do you follow?
Swelling.
Yeah, the swelling, the very bad spleen. So, siguro we need to also inquire ano yung background niya, yung lifestyle niya, ano yung mahilig niyang kainin. Okay, he's only 30 years old. And you need to also consider, kasi parang napakalaki ng dila niya para sa bunganga niya. Any comments, Sir Timothy?
Mm, uh, for me, Doc, yeah, with this picture, we can't really like fully tell it, because it's a picture. We don't know if it's really very clear, no. But other than it's for me, it's bluish purple siya, Doc, eh.
Yeah.
Bluish purple siya. So there be a blood stagnation, kidney young deficiency, of course the dump detention. Uh, yun. So it's already affecting also the heart. So yeah, it's heart blood deficiency or stagnation. Yeah, heart blood
How do you,
stagnation.
yes. How do you think the kidney stones evolve? Like, what made this patient develop kidney stones?
Mm, what did you say?
Siguro, I'm beginning to suspect ang problem, asymptomatic yung kidney stones eh. No? What do you think?
There's the high chance, no. There's a possibility. It's just a symptoms pa lang. I think, Doc, with that, in lower extremities niya, I think he always feels cold. Then yung urination niya, pa-konti-konti lang. Frequent siya, but pa-konti-konti. Oo.
Okay. And that was because of the stones.
Yes.
Yeah. Kasi ganito yan eh. Even if you have kidney yang deficiency, kasi when you have kidney stones, definitely there is, a diuresis palang kumonti yung tubig mo. Pero in this case, mas matindi yung kanyang kidney yang deficiency compared to his kidney yin deficiency. Diba? So, nakikita nyo, definitely there is stomach yin deficiency. And when you have stomach yin deficiency, you could have kidney yin deficiency, right? But this was overshadowed by by the kidney yang deficiency. Kasi hindi ka mo pwedeng kidney yang deficiency lang. Definitely, you will have also kidney yang deficiency. But in this case, there's more yang deficiency because of the spleen, right?
Yes.
Yeah. And also, meron talaga siyang constitutional deficiency. Kasi pag ang pasyente may stomach deficiency, definitely, meron din siyang spleen chi deficiency. Diba? So yun.
Yes.
Okay. So what do you intend to do with the patient, Ma'am Roxanne? Is this your patient? Yeah. Yeah. Medyo ano ba siya? Medyo on the heavy side. Okay. Kasi yin na yin talaga yung kanyang dila eh. In fact, this is a classic example of yin excess. Super dampness. No, diba? So, yang deficiency. Sobra yung yin, pero sobrang kulang yung yang. Okay? So, parang it's like, ano ba to? This could have been chronic already. Right? Chronic na yan. Super laki na eh. You don't just have a tongue this big in just a few months. This is already phlegm eh.
Yes.
Sabi mo nga, tumaba siya, no? Thank you very much. Okay, so tanungin daw natin ano yung hilig niyang kainin. I'm sure mga sweets, raw food, or
Salty.
salty, yeah, salty. Okay. Sige, follow up natin, Ma'am Roxanne, no? Okay, Ma'am Naomi, how is your mom?
Good evening po. Nag-improve naman po.
Asan yung bagong tang niya?
Hindi ko po nahingi kasi tulog siya ngayon eh. Tulog siya kanina. Pero nawawala na yung sikmura. Di ba palagi siyang sinsikmura? Yun yung pinaka-problema niya dati. Hindi siya nakakatulog. Ano na, Dok? Mga siguro 3 days na rin na noong okay. Kahapon at ngayon hindi na siya inatake ng sikmura niya. Tapos,
Wow.
mataas na yung tulog, mahaba na yung tulog niya ngayon. Tapos, kahapon, humingal pa siya, pero very, very ilang seconds na lang siguro. Ngayon din, parang hindi siya nagreklamo ngayon. Tapos, iba na yung aura ba, yung nakikipagchika na, yung pagka may hindi magandang nakikita, nagre-react na mga ganon. Dati wala eh, parang yin na yin.
Nakakausap na siya.
Nakakausap
Responsive.
naman siya, pero oo, mas responsive siya ngayon. Eh siya na nga nagluto kanina eh, matagal. Mga ganon, dati wala. Siya nagluto ng para sa hapunan na ulam.
Buti naman. Okay. Parting words, Ma'am Naomi. Thank you very much, Sir Timothy. Ma'am, nawala yata si Sir Resty.
Na ano siguro, naputol siguro do. Nag-text man sa akin.
Okay.
Oh,
Sige.
so thank you so much sa mga nag-attend ngayon. Of course, gusto ko pasalamatan una-una talaga ikaw, Doc Hec. Mga si Sir Timothy, someday we want also to hear from your sharing, sir. Ma'am
He had
Roxanne,
lots to share.
yeah. Di pa kita kilala, Sir Timothy, pero ang dami ko nang narinig mula kay Doc Hec sa'yo.
Oh no. Oh no.
Parang
When are you
pagkakita
getting married, Sir Timothy?
Next year. Next year, Doc. Hopefully next year na.
Padalan mo kami ng food.
Sure.
Virtually, di ba? You attend. Ma'am Betty, maraming salamat
Thank you po.
Maraming salamat, Ma'am Betty.
President,
Thank you,
thank you for attending. At
Ilang.
Ma'am Roxanne, maraming salamat sa napaka-active na. Grabe to si Ma'am Roxanne. Sa dinami-dami ng activities, pero pag lamp, andyan pa rin yan. Ngayon sa Quantumin Check, andito pa rin yan. Thank you so
Okay.
much.
Thank you very
Thank you po.
much.
Good night.
Thank you, Doc.
Good night, everyone.
Thank you
Keep
very
safe
much. Good night.
tomorrow.
Pag walang mga tangs, we will have the lecture. No? Okay, thank you
Okay,
po.
Doc.
Good night.
Bye-bye, Doc.